Okay, for this skill, the catheter care skills, first I have a couple objects that I'm going to be using. This is going to be my basin, my bed protector, my wash rag, gloves, and a bath blanket. So, before entering the room, you must knock. Once you have entered the room, you will greet the patient, introduce yourself, and let them know what you're there to do. After you've done that, you're then going to wash your hands and pull a curtain for privacy. After you have provided privacy, you're going to fill your basin with fill it up 2/3 of the way with warm water. After you have done that, you're going to make sure that the bed is adjusted to the right height for you. So if it's not, you need to raise the bed rails and then adjust the height of the bed so you're not bending over on your tippy toes. The next step is to put the bath blanket on the bed, but you don't want to shake it out. So you just unfold it slowly without shaking it out. And then once you have your bath blanket covering your resident, you're then gonna fan fold the sheet on them downwards towards their feet. And you're also gonna want to make sure that they're not exposed in any way. And then once you've got that sheet pulled down, you're then going to want to put your gloves on because you're going to be placing the bed protector underneath the resident. So. Next, you're going to want to grab your bed protector and unfold that and place it underneath the resident's butt. So just lift them up and slide the bed protector underneath. Once you've done that, you then need to expose the perineal area so you can get them cleaned. Next, you're going to want to separate the labia if it's a female, and if it's a male, you're going to want to separate the foreskin. And also, you want to observe for any crust or secretion and abnormal drainage. After you've checked for all that, you then take your wash rag, and with the soap and water, you're going to clean around the area, the entrance to the catheter. And then once you've cleaned around the area, you're going to want to wipe 4 inches down the tube, but only down, you can't go up. Once you have cleaned that, whenever you wash around the area, you use one side, and to clean the tube, you have to use a clean part of the bag. Once you've done that, you then need to rinse the area. So with a rag with just water, you rinse the area off and you pat it dry with the clean. And once you've done that, you need to secure the catheter to the leg. Make sure the catheter is secured to the leg and check for any kinks. Once you have made sure there are no kinks and the catheter is secure, you then take the bed protector out from under them and throw that away in the appropriate bin. And also at that time, you will then need to take your gloves off pinching and pulling, wadding 2 fingers so you're not touching any contaminated areas. Once you have removed your gloves, you then need to remove the bath blanket, but you need to have them covered up with their sheet first. So just pull that sheet back up while keeping them covered. And once you've got that sheet back up and they're all covered, you can then fan fold the bath blanket down. And you're going to want to roll the blanket and throw that in the hamper. Fix the patient's sheets so they're all nice and neat and they don't get tangled up. After you've done that, you then need to raise the bed rails back up, adjust the height of the bed for the patient, move their call light towards them, and once they're all good to go, you can do your hand hygiene and report and record.